So for today, what I'm hoping to do is just start a trend where we're going to be doing some online events to be able to share information with our patient community. And this is part of our mission to not just treat patients one-on-one in the clinic, but create a community that is healthier, both in terms of our own patient community, but we have a vision of inspiring people to spread ideas about the possibility of living healthier lives out there. So I thank you all for your patience, and anyone who is joining me live or watching later on in the recorded version, hope that you will join me in future. Tonight, what we're going to do is we're going to start by talking about something that we do a lot of in the clinic, which is platelet-rich plasma, or PRP therapy. And when we're in office, we don't always have the opportunity to talk at length about what PRP is or how it works, but this is that opportunity tonight. So if you have any specific questions, feel free to ask in the chat window. And so just in general, here's some general information about naturopathic medicine. Of course, in BC, naturopathic doctors are licensed. So anyone who has an ND after their name, you can be assured that they have a certain amount of education. They've gone to an accredited naturopathic college and graduated, and also have passed all of the board exams that are standard across naturopathic medicine. In general, all of the treatments that we use here at the clinic are based on the idea that we're trying to support and stimulate the body's natural ability to heal. And so whenever we're looking at any kind of a problem, we're not just looking at the symptoms, but trying to understand what the underlying causes of the problems are. So again, in BC, which is where we are, in case anyone's watching this from elsewhere on the internet, naturopathic doctors are licensed primary healthcare providers, and we have passed standardized North American board exams. We are licensed registrants of our regulatory college, which is the College of Naturopathic Physicians of British Columbia. And we're medically trained, so we have training at one of the accredited colleges across Canada and the US, which is a 4-year program. And for additional advanced board certifications like prolotherapy and PRP, there's additional education that has to be completed. So this is, again, just some general information about what naturopathic doctors do. And of course, we treat a wide variety of conditions, but tonight we're focusing specifically on what PRP for joint pain and injury does. PRP and injection therapies are just one of the advanced therapies that we use. In addition, there are other board certified treatments such as the ones that you see here. But we'll talk about them at a future date. So the main thing that brings patients into the clinic is pain. And so PRP as a treatment is one of those therapies that we quite often use to resolve pain and injury. And when we're talking about pain, it's always important to understand what's causing the pain. So quite often, by the time somebody comes to see me or one of the other doctors in the clinic, we're talking about something that's chronic, not always. We also do treat acute pain and injury, but we definitely tend to see more chronic issues. So some of the different pain generators can be muscular, can be related to vascular issues or blood flow, could be skin, organ, bone. For the most part, though, tonight what we'll be focusing on is the connective or joint tissues, so ligaments, tendons, cartilage, and meniscus. There are a number of different advanced injection therapies, but prolotherapy and PRP, or platelet-rich plasma, are the ones that we're going to focus on tonight. However, when it comes to pain, there are other therapies that the doctors here at SCIMEDICA use, including treatments such as trigger point injections, neural therapy, or perineural injection therapy. So, in general, there's different ways to think about how to treat pain. And in the conventional realm, most of pain treatment involves an anti-inflammatory approach. Now, tonight, we're going to talk about PRP, or platelet-rich plasma, and how it treats by actually stimulating a regeneration of tissues. Now, inflammation, as I mentioned, is actually something that, from a conventional standpoint, we want to actually eliminate or get rid of. And so when somebody has pain or injury, oftentimes anti-inflammatories are part of the treatment. But if we think a little bit more about how the body's working, we need to think about what inflammation really is. Is it a sign of the body breaking down, which it could be? Or at times, is the inflammation really an attempt by the body to actually heal? And so when we talk about inflammation, we're talking about some characteristic signs like redness, pain, heat, swelling, and loss of function of that joint or body part. Now, redness is something to think about because obviously that redness has to come from somewhere, and in large part that's an increase in blood flow that the body's actually providing to an injured area. We'll talk more about why that increased blood flow is necessary, but at the same time insufficient to actually resolve healing. Pain, again, is there a purpose to the pain? Well, one of the more obvious things about why the body is eliciting pain is probably because it's trying to tell you that there's a problem, that maybe you should not be using that body part because there's some injury there. So pain is a protective mechanism, or a mechanism that the body uses to signal to you to protect an injury. Again, the heat, that again is coming from an increase in blood flow. And swelling, again, there's activity happening when there's an injury, and there's increased swelling and fluid and blood flow. And then again, a loss of function again is probably the body's attempt to protect itself, or protect itself from you. And this is an issue that I end up talking a lot about with a lot of my athletes, who mind over matter, want to push through the pain. Now, in terms of the types of inflammation, this is actually also important because the types of inflammation are going to dictate whether or not it's a useful process or a process that's actually degenerative and maybe harmful in the long term. So the two types of inflammation we're talking about are acute or short term and chronic or long term inflammation. So acute inflammation has some characteristics that we would actually identify as, initially being harmful or undesirable. But at the same time, the inflammation that comes with acute inflammation is something that is contained. So it comes on quickly, it's short-lived, and then the body actually gets better. So maybe if somebody sprains their ankle lightly, right away you're going to get some pain. You might even get a little bit of swelling, but within a few days, hopefully it actually goes away. And you don't feel pain and you regain use of that joint. Chronic inflammation is different. So, of course, with chronic inflammation, you may have something that lasts not a few days, not even a few weeks, but maybe several months or even years. And when something lasts that long, you have a pretty good indication that the problem is ongoing. And so the outcomes of chronic inflammation are different. You don't get something that is contained and resolved. Instead, you get a process that just is never ending. Tissue is actually, degrading. You're getting fibrosis or scarring. And in, really chronic cases, you may even be getting cell death or necrosis. So, as a naturopathic doctor, my assumption about my therapies is that we are stimulating the body's ability to heal. And so then people would ask, well, how come then my knee or my back or my ankle or my shoulder, I injured it years ago, decades ago maybe, and it's still not better? Why is that? Well, from a PRP or prolotherapy standpoint, we would explain this in the context of joint tissues not having a very good blood supply. So the picture here is an illustration of an island. You have tissues that are injured, but how do we get the blood supply or blood to the area? One example that's more specific would be something like an Achilles tendon. Okay, so for those who don't know, I'm sure most of you know, but for those who don't, the Achilles tendon is the tendon on the heel, the back of your ankle. It's the longest tendon, and typically athletes, runners can develop Achilles tendonitis. And so just looking at the picture here, you'll see that you'll notice there are areas where the tendon, the white structure there, has some slow to heal areas that are illustrated here with red patches. And so over time, you do an activity, let's say you run, and you might stretch the tendon and create some minor tearing. That's what they would refer to as grade 1 injury. And then as time goes on, because the tendon does not have good blood supply, you start to get more and more and more significant tearing or injury to the tissue. And so in the end, you end up with Achilles tendonitis, or in a worst case scenario, you get an Achilles rupture. Another joint that we would use to illustrate this chronic kind of inflammation might be in the knee. And we talk about a tendon having poor blood supply. Well, joint tissue that has even worse blood supply would be cartilage. So in the knee, you're talking about osteoarthritis. And so for any of you out there who have been talking to your doctor and the doctor says, you've got arthritis, most of the time when we're talking about a knee, we're talking about osteoarthritis, or the kind of arthritis that's actually related to wear and tear. That's different from rheumatoid arthritis, which is more systemic inflammation and can be a result of problem with not wear and tear so much as it is your immune system attacking your own tissues. It's important to understand when people ask, and I get that question all the time, is PRP good for arthritis? The answer is, well, it depends. It depends on what kind of arthritis you're talking about. So PRP for treatment of osteoarthritis can be extremely effective, and we'll talk about why. For rheumatoid arthritis, we need a different approach. So again, common treatment options for pain and injury conventionally include things like medications such as anti-inflammatories and painkillers, more physical types of therapy and surgery. And then some of the commonly used drugs, of course, have side effects. So I think most everyone's familiar with the use of non-steroidal anti-inflammatory drugs, NSAIDs for short. These would include ibuprofen, Advil, Aleve, naproxen, things like that. And so they have some side effects that mostly are manageable, but with long-term use, the one that definitely most people end up having problems with is their gut, their stomach. It creates problems with the gastrointestinal tract, including not just gastritis and stomach upset, but even stomach ulcers. So you can imagine then if the reason why you're taking the anti-inflammatory is not being treated properly, you will have to keep taking the anti-inflammatory, and the longer you take the anti-inflammatory, eventually you're going to have a problem with your gut. So you start off with one problem, you don't treat it properly, and then you end up with another problem. The other medications, such as the corticosteroids and biologics, also have their side effects. We won't dwell on those too much. Cortisone injection is something that a lot of patients ask, is PRP like cortisone injection? And of course, no. If anything, I would say that PRP injection is the exact polar opposite. Cortisone is an anti-inflammatory injection. It's a corticosteroid. And PRP, as we'll talk about here shortly, is the exact opposite. But in many cases, having a cortisone injection may actually help with pain and provide relief. But again, the question is the treatment actually curing the cause of the problem? And again, there are risks with cortisone injection. Most of these are more significant in repeated injections. So, for example, if somebody's had multiple cortisone injections in the same knee, you may start to have some side effects from cortisone. Bottom line is cortisone injections are one option, but they do carry certain risks of side effects, and they do not address the cause of the problem. So when we talk about joints, a lot of times we'll hear patients say that, oh, they've been told, well, you kind of have to learn to live with it. What do you expect? You're X years old, wear and tear, stop doing your activities. So is that really the case? Is it all downhill? And of course, we wouldn't be talking about this if the answer was, there's nothing you can do about it. Certainly, I'm here to present the case that you should think about another option, because your body does have the ability to regenerate. As simple as whenever you cut your skin, it bleeds, it regrows. Now, it has to go through a process. It turns out that process is an inflammatory process. But the body can rebuild itself. So when you think about connective tissue, though, so when I say connective tissue, I'm really specifically talking about joint connective tissues, so ligaments and tendons and cartilage. The first statement on this slide, which says that, under ideal conditions, the connective tissue, it goes back to its original length after being stretched, but it's only going back to maybe half or 3/4 of its original strength. That's really key. I mean, think about it in the context of somebody who's had a car accident and had whiplash injury. There are ligaments between all of the vertebrae in your neck and spine. So a whiplash injury is going to stretch out all of those or many of those ligaments. And imagine that, once you've stretched those ligaments, they're not going back to their original strength and stability. They're going to lose some of that. And if you have a loss of stability in your neck and upper back from the ligaments, it's not that hard to understand why the muscles start to seize up, because they're actually going to compensate. Your ligaments can't stabilize your neck and upper back, then the muscles will. So you get a reaction, and that's why so many people who've been through a whiplash injury from car accident, they go to their doctor, they get imaging like MRI or X-ray. Everything can look normal, but they definitely don't feel normal. They're in pain. They're having a lot of tension and muscle stiffness, inflammation. Why is that? Well, it's the connective tissues that don't heal. You may not even break bones, or rather, I was going to say you may even break bones. The bones will heal up, but all the connective tissue that's holding the bones together doesn't heal up very well. And so I don't want to get too detailed into all the mechanisms about why those connective tissues don't restore back to their original strength. But for lack of a better or for time's sake, suffice it to say that the ligaments, once they get injured, we need to do more than just wait for those ligaments to get back to normal. We have to actually do something above and beyond. So, the inflammatory process, if it doesn't result in repair of tissue, it results in scarring. And oftentimes, you're getting both when the body's trying to heal up. You're getting some repair and you're getting some scarring. But poor wound healing has certain characteristics to it that are different than proper healing. You scar tissue is stiff. It's irregular, and it's not very elastic. It's disorganized. Okay, but it's the body's attempt to resolve an injury. And so, back to the example of the Achilles tendonitis. A runner who does not have or a runner who doesn't heal up their Achilles properly, you can develop a really chronic Achilles tendonitis, which in medical speak is more accurately described possibly as a tendinosis. So what this picture is really showing, on the left, you see what we would consider kind of a healthy tendon, and the cells and tissue fibers, how they look when things are healthy, they're organized. Versus on picture B, I don't know if you can make it out, but you have an area there between the arrows that's just kind of a jumbled mess, essentially, because you're not actually having collagen organized. Collagen is the protein that makes up your tendons and ligaments. So when the collagen's disorganized and you have a lot of other stuff filling that tissue space instead of just organized bundles of collagen, you're not going to have a very functional tissue, and you're not really getting any tissue regrowth. So if you start at the top of this diagram, what you'll see is that, let's say, for example, the example of the Achilles tendinosis or tendonitis. First, your Achilles is sore. And then you move down to the right, inadequate repair. So you don't really heal the Achilles very well. And so what ends up happening is that tendon now has collagen and protein fibers that are either very disorganized, or there's just less of that collagen. And so tenocytes are the cells that make up or build up tendon tissue. They start dying, so you get even less collagen. And then now your Achilles is weak, and so it's more vulnerable, and you are even more or you have even more disorganized repair, you get more tendon cell death, you get less collagen, and so on and so forth. So it's a vicious cycle. And usually, not always, but usually the athletes that I treat, when they're going through this, they're actually still maintaining their activity. They're still running. It's painful, but they're still running because, mentally they think they should be, or they have to be, active. And of course, you can imagine, if you have an Achilles tendon that's not repairing very well, being active on that tendon is a problem. So how do we actually break this cycle and get get adequate repair? Well, that's where we start to talk about PRP. So a discussion of PRP needs to be prefaced with a short discussion about prolotherapy. And this is a picture of Dr. George Hackett, who coined the term prolotherapy. But prolotherapy and PRP are on a spectrum of treatments that we would refer to as regenerative injection therapies. So these are therapies where we're actually trying to grow tissue. We are not scarring the tissue, which is a misconception of prolotherapy. It does not create scar tissue. We're actually stimulating regrowth. Okay, and where we're stimulating the regrowth can depend, but for the most part, we're really trying to stimulate the regrowth right at the junction where the ligament or tendon or cartilage is attaching or connected to bone. Okay, because that is the area that's the weakest link, or the most vulnerable area, and that junction between the ligament or tendon and bone is called the entheses. There are various substances that we can use to proliferate or grow the connective tissues. The most traditional substance that was used in prolotherapy was just straight dextrose or sugar water. But that dextrose has its effects at very particular concentrations. Since the advent of prolotherapy, therapists have gone on to use different kinds of proliferants and different types of tissue regrowth as a result. Tonight, though, we're going to focus on PRP. But in general, the basic process is you inject a proliferant where there's an injury and you're going to create a localized inflammation. That localized inflammation starts a healing process, and then that healing process results in new collagen being laid down and an increase in size and strength of, in this case, ligament or tendon. So the process that results from prolotherapy, and particularly PRP, is one where you're growing something. That's very different than a conventional approach that is taking an anti-inflammatory approach. An anti-inflammatory approach is not growing anything. In fact, it's actually working to reduce the inflammation that the body's trying to initiate. Now, there is a very good rationale for doing that in many cases, but long term, for injuries that have not healed over many months and years, we need to start thinking about, okay, is the tissue now in a process where we are being degenerative, or we're in a, not tendonitis, but in a tendinosis? So we're losing healthy tissue, we're getting more disorganized tissue, the tissue's becoming less functional. If that's the case, we want to actually consider, can we break that cycle? Can we actually stimulate the tissue to grow? And so there are many growth factors in the body naturally occurring. This list, which is probably way too tiny on your screen, but this list is just to illustrate how many different growth factors there are that occur in the body. And of course, growth factors have their role in regrowing many different types of tissues, but they very importantly have a role in regrowing joint tissues. So the idea that, well, it's all downhill as you get older, that's something that I'm certainly not willing to accept, and science isn't either. So again, focus of treatment is at the entheses, where these connective tissues attach to bone. And so when you're rebuilding connective tissue, what is the process? What's the time frame? Well, looking at how connective tissue rebuilds, you can see that for the first 2 days, you get an inflammation, you're getting some clotting, you're getting growth factors. And from 2 to 4 days, you're getting proliferations. So you have these cells called fibroblasts that actually their main function is to produce more fibers, okay, connective tissue fibers. So prolotherapy gets its name from this proliferation of tissue. After your body produces this new connective tissue, you start laying that tissue down, and you start to also revascularize or reestablish blood circulation. So those are the first 2 weeks. Then from about 3 weeks onwards, you take what the body's grown, laid down, and you start to actually remodel it or reorganize it. So you take tissue that has regrown, and you're actually, arranging it into more and more stable, more and more functional conformations or arrangements. Of course, for prolotherapy and PRP, for us to be talking about it, it's something that had to be popularized because this is outside of the standard of care when it comes to orthopedics. The standard of care is more anti-inflammatory treatment. So prolotherapy and PRP really became more popularized by athletes and the sports world. These are a couple of pictures. These are old news. I think, the Heinz Ward article there, you can see that's dated Saturday, February 7th, 2009. So since then, many high-profile athletes have used PRP, and probably many who haven't even talked about it. But suffice it to say, PRP has been used in the sports world for many years. One of the common questions that I'll get is there any research? Is there any evidence? And so here are a couple of resources for research and evidence on prolotherapy specifically, but included in that is probably a lot of information about PRP as well. And so when should you think about PRP, or when would PRP be indicated? Well, certainly if something's really chronic, if it's past that initial acute stage and it's still not healing, not getting better, we need to start thinking about, okay, well, maybe we need to actually start thinking about using a regenerative therapy, something that's stimulating tissue. Ligaments and tendons that are in joints that are really hypermobile or unstable, those are prime candidates for PRP. And then anything where you need to stimulate tissue growth, that's also something that you might consider PRP for. As I mentioned in the sort of shorter video, just briefly talking about what PRP is on the YouTube channel, PRP actually was popularized more from the dentistry and oral surgery world. So they are using it to stimulate growth of those kinds of tissues. Just a side note, there are other types of injections that we use for pain and injury. Trigger point injections are more for muscle. Neural therapy is more related to treatment of the nerves. So muscles and nerves obviously can be pain generators as well. Perineural injection, yet another nerve targeted treatment. Used to be called NeuroProlo, but it was a bit confusing because the mechanism is a little bit different than the proliferative mechanism that we're talking about with prolotherapy and PRP. So that is the PRP process or mechanism in a nutshell. Just to talk very briefly about like the actual PRP visit. When you come for PRP treatment here at SCIMEDICA, you're going to plan to be here for about an hour, maybe a little over an hour. Because really what happens is first, assuming that we've assessed your injury and decided that PRP is well indicated, then we have to draw blood. And we draw, depending on the area being treated, we may draw as little as 3 or 4 vials, or we may actually take up to 6 or more. Then once we've collected that, we have to actually put it in the centrifuge and separate it out, and then process the PRP or platelet-rich plasma itself. That is a process that takes maybe 20 to 25 minutes. So we have to actually isolate the platelets and then keep them active and then stimulate them. So that PRP preparation process is very important. It really dictates to a large extent how effective the treatment's going to be. Other things that dictate that, of course, are the health of the patient. So it's not magic what we're doing. We are stimulating the body to heal. So the better able your body is to heal in general, the better the PRP is going to work. Because when you actually think about it, what you're doing is you're isolating the parts of the blood that would normally create that inflammation and then that tissue regrowth. So the quality of your blood is very important to determining how well you actually repair. And so this process of using PRP for treatment of pain and injury is one that is essentially just an enhanced version of what your body naturally would do on its own. The big differentiating factor, of course, is that when you can actually inject the PRP right where it's most needed, you're overcoming one of the major handicaps that the body has, which is it isn't really able to supply joint tissues like ligaments, tendons, cartilage, meniscus. It isn't able to supply them with good blood flow on its own. That's just the way the body was designed. So that's why in many cases, people who are active, they will end up complaining about their joints. Everything else is okay, but their joints are breaking down. So we're doing something with PRP that is, I can't say that it's 100% natural. We're taking out your blood, spinning it down, and then re-injecting it. But it's essentially enhancing a natural process that your body would go through on its own. Because after you inject the PRP at the site of injury, all the rest is your body's natural healing. So, I hope that this was helpful. I'm really looking forward to being able to do more of these types of events online, because we here at SCIMEDICA are really committed to giving people the knowledge about options of how to stay healthy and live healthier lives. That doesn't always have to be one-on-one in person in the clinic. Sometimes we can do things using technology to be able to reach more people. And that's one thing that I'm really looking forward to. So I'm also hoping that anyone out there who has suggestions about future topics or things that they would like us to talk about in the future, I want to hear about that as well. Because we have our ideas about what we see in the clinic often, but you know what's important to you, and we want to know about it, because if there's anything that we can do to help support you in your journey to living healthier lives, we want to do it. Okay, well, that is 6:30. So that's great for the first event. Thank you very much for joining me. And I hope to see you soon. If you're interested in staying on top of future events and want to know more, then subscribe to the channel. Also, we'll be emailing notice of future events and future topics. Okay, so looking forward to hearing from you guys about what you want to know about. Until then, take care. We'll see you soon.